and therefore we need to take steps to prevent it. That's the beauty of heart disease. It's largely preventable by simple measures, but we need to be aware of it in order to achieve those preventive measures. There's one we can't do much about, which is our family history. Our genetics can't be changed. But you can fine-tune them if you take care of all the other risk factors. Smoking is a recognized risk factor for heart disease, and of course, the solution there is to quit. We have hypertension. Hypertension is a common risk factor that can be easily treated with medications. The same can be said for high cholesterol. And then of course you have diabetes. Diabetes takes an extra importance nowadays with the obesity epidemic we're going through in the United States. And obesity carries diabetes. And once you have diabetes, it's a whole different ballgame, because diabetes is one of the main contributors to the production of coronary disease, coronary blockages, that eventually will lead to a heart attack. And all these risk factors can be treated, can be modulated with medications, with treatment, with diet, with activity. When it comes to Hispanic women, we have extra things we need to worry about. Probably the most important one is the cultural aspect, which acts in two different ways. One is our diet. Now, our Hispanic diets are delicious, but they are very rich in carbohydrates. Now, there's another cultural factor in terms of the role of the women in the Hispanic family. The Hispanic mother is a bit more of a caretaker, and she has to take care of everybody else in the household, and she comes last. And obviously that leads to problems, because it can eventually lead to delayed treatments, delayed searches for help in terms of looking for your doctor when you have risk factors, or looking for a physician when you have symptoms that can be introduction to a heart attack. You know, many times when patients have a heart attack, they can have symptoms for days before the heart attack actually occurs. And if you don't act on those symptoms quickly, then it may be too late by the time you ask for help.